I have the honor and pleasure of helping this lovely young lady, and things like that happen to us all. You can be the best surgeon, things can happen. And one of the things that can happen is that when you do the surgery, the wound can open up, you can have an infection. Some people, even if they're not African American, can develop a keloid or a hypertrophic scar. Most of the time, this situation occurs on the face because of tension. It have nothing to do with genetics. Even if you do a good job in the stitching, too much tension just on the surface of the skin will result in the skin building extra collagen for fear that it will rip. And there is a special technique you need to use in order to reduce the risk of developing keloid and also reducing the chance of the wound dehiscing. And the way you do it is by making sure that the skin is tied together without any tension on the upper layer of the skin. So all the tension has to be relieved from the surface, and in this case, done through the fascia, which is the layer that covers the muscles and supports the rest of the skin above and below. How long did you have the scar there before, and what did the doctor say about it?
She told me about a scar revision.
Which is surgery.
Она хотела, чтобы я приехала к ней, она это сделала. Но я выбрала доктора Levit.
Почему, если можно на языке?
Ну, потому что я слышала очень много хороших отзывов.
Спасибо большое, что доверила. So far, I hope you're satisfied with us and with the staff and Monica and everybody else who helped.
Прелесть моя.
Спасибо.
Да.
So when she came with a very thick and tender keloid, especially when you have the hair beautifully cut the way she does, you could see that scar and it bothered her, it was hurting her, etc. So what we did is we tried some steroids, but it was still wide and stretched. And then we decided to cut it out. And when we cut it out, she was concerned, obviously, like anyone would be who's smart. It's good, thank you for trusting me, but it was the right thing that she was concerned. How do I know that you're going to do it and you'll be fine? And you don't. You have to do everything right, and then you hope there's no infection. The patient follows the instructions, and if they follow the instructions, then God willing, everything will be right. And indeed, she followed the instruction. There was no infection, and everything healed well. And we just took out the sutures. And it's very important to know, when you are done with the stitching, you want the skin to look like a harmonica, like a little bit of a mountain together. This is not a keloid. This is just the tightness from the bottom. If I put skin like this together, it will have a wrinkle. That's what we want to do, because as the skin stretches, and it will by movement, by talking, it will relax, and as it relaxes, it will flatten out down. And that will happen when the inside suture will dissolve. And depending on the type of sutures that you use, it may take anywhere from 1 month to half a year. And in this case, we use stronger sutures, so about that time. The other thing is we injected a little bit of topical steroid right in front, because we didn't want to go ahead and do too much surgery there, because as they did the surgery, they pulled a little bit the ear forward and they cut a little bit of the tragus. That can also happen when you do facelifts. You gotta be extremely careful with that and not put too much tension. When there is a lot of tension, it can pull the tragus a little bit forward. But then again, if you want to have a lot of skin removed, there will be tension that will be pulling it out. So it's gotta be somewhere in the middle. People may, if you don't remove enough, they'll say you didn't remove enough skin. If you remove too much, they'll say, oh, I can see a little bit more of my ear canal, etc. So it's got to be a middle ground that you and the patient agree upon in advance, so that everybody will get good results without hopefully getting untoward, undesirable effects. But anyway, this is it, and she's just beautiful, and she followed the instructions, and I'm very proud of you. Thank you.